Hello everyone. So, I am here again for the new lecture, National Program for Control of Blindness. Yes. So, in this program we will discuss about the objectives or goals of this program, and after that we will see what is the infrastructure under this, okay, what are the causes of the blindness and what are the data saying for the blindness in our country. Yes. So, we will start with the National Program for Control of Blindness and visual impairment. Yes, so it is written as short form. It was launched in the year of 1976, and in the 1976 it was totally 100% centrally sponsored scheme. Yes, but now there is a change. So, it is 60-40 in all of the states. So, 60 by the central or by 40 by the states, and in some of the any states, northeastern states. So, we have 90-10 ratio. Okay, with the goal of, so what is the goal? The goal is the same, reducing the prevalence of the blindness to 0.3%. Okay. So, we will see what is the prevalence now and how it is reducing. Okay. So, the what is the survey? Rapid survey on avoidable blindness, which was conducted by National Program for Control of Blindness during 2006 and 7. Okay. So, this is the one of the survey, and it is showing the reduction. So, there was a prevalence of 1.1% in 2001 to 2002, okay, which is reduced to 1%, okay, in the 2006 to 2007, and now what we want? We want it up to 0.3%. Okay. How will reduce it? So, this is the main thing under this program. Okay. It will implement our program successfully, of course, will reach to this level. Now, it will see some prevalence rates of blindness and the targets. So, prevalence of the blindness, the survey report of 2001 to 2002, it is 1.1%. Okay. Blindness, prevalence of blindness in the report of 2006 to 2007, it is reduced, okay, to 1%. Now, the current survey, the data for the year of 2015 to 2018, okay, we are doing this, and the projected rate they are accounted up to 0.45%. Okay, and our main goal is to make the prevalence or to reduce it at least to 0.3%. Okay. So, this is the prevalence rates. Now, see what are the reasons why the blindness occur. So, what are the main causes if we will see it globally? So, we will find the most common reason or most common cause is the cataract. Okay. So, cataract is one of the eye problem. In this what happened, the proteins or this protein content, they start to degrade, okay, and they start to form these spots under the eye, and which is causing the vision abnormality. Okay. So, the vision is not clear, which is accountable up to 62.6%. Then further you can see the other common reason is the refractive error. Okay. So, in the refractive error what happened, the sensitivity of the light to the retina is lost. So, there is a vision problem, the vision is not clear, which is accountable to 19.7%. Okay. After that, corneal blindness. Okay. So, here the cornea is disturbed, it is accountable to 0.90. Okay. So, the transparency to cornea is lost, that is why there is a vision problem. Okay. So, the person is not able to see properly. After that, there is a glaucoma. So, glaucoma is one of the condition which is caused by the pressure changes in the eye. So, there due to the fluid accumulation inside the eye. So, it is accountable nearly 5 to 5.80%. Then after that, there are some other causes like surgical complications. Okay. In some of the surgeries we have seen that they on further they are causing the blindness. Yes. So, it is 1.2. Then posterior capsular opacification. This is one of the situation which arises after the cataract surgery. Okay. So, it is accountable nearly to 0.90%. Therefore, it is very important even after the surgery we need to follow up. Okay. Posterior segment disorders. Okay. So, in this what happens, the back segment of the eye, it is defected, okay, nerves are damaged. So, it is accountable to 4.70. Now, there are some, apart from all of these reasons, there are some other reasons as well, which is accountable nearly 4.19%. Okay. So, these are some of the common reasons why we are reaching to blindness. Now, coming to the main objectives. So, see, our main objectives of National Program for Control on Blindness. To reduce the backlog of avoidable blindness. First of all, whatever the blindness which we can avoid, try to avoid it. Okay. So, reduce that. How will reduce it? Through early identification. It will identify. For that we need the diagnostic technique. For that we need the screening technique, and provide the treatment of curable blind. Okay. So, we are not talking about the unavoidable. We are talking about what we can avoid at primary care, secondary care or tertiary level. Okay. After that, develop or strengthen the strategy of NPCB for eye health to all of the people. Yes. For that what we can do, we can provide free camps, okay, monthly on weekly basis. So, there should be free or eye health for all, okay, and prevention of visual impairment through provision of comprehensive universal eye care services. Okay. This we will how will do this? By the intersectoral coordination, then only we will see the universal eye care services. What are the universal eye care services? Okay. What are the new techniques are coming? How will screen the problem as early as we can do, okay, and quality services delivery. So, these are under your objectives. Now, what are the other objectives? So, strengthen and upgradation of our institutes, okay. So, regional institutes of ophthalmology, this is the institutes which is working on eye, okay, to become center of excellence in various subspecialty of the ophthalmology or to make new one also. So, whatever the infrastructure we have, first we have to strengthen them, upgrade them, okay, provide the facilities to them. Also, other partners like medical colleges or district hospitals, sub-district hospitals, vision centers or some of the non-governmental organization eye hospitals. Okay. Then what are the other objectives? So, see, strengthening the existing infrastructure facilities and developing additional human resources. Now, we have strengthened, okay, we have provided all of the new facilities which are coming to the hospitals or vision care centers, and we have upgraded. Now, researches are going on, okay, but for all of the researches or for working of all of the hospitals, we need human resources. So, we need ophthalmology assistant, okay, we need some ophthalmologic surgeons. So, that is why it is written human resource for providing high quality comprehensive eye care, because that is their specialty area, they can understand well, okay. To enhance community awareness. In all of the objectives for any of the program, you will see IEC is very important, information, education and communication. Without information, education and communication, without awareness, we cannot implement our program, we cannot make our program to successful, okay. So, for that we need proper awareness, okay. Increase and expand research for prevention of blindness. Now, there are many diseases which are causing the blindness, okay. That could be the secondary cause, okay. So, we need to know about all of the diseases. There are some of the agents, there are some of the medications which are causing the blindness. So, we need to know, and how will need to know? Only by expanding our research, only by increasing our research, okay. To secure participation of voluntary organization. Now, if any hospital is working and government has prepared one of the infrastructure, so not only those infrastructure, but apart from it, what are the other local authorities or other health authorities which are working, they should be they should take part in an integration. So, to secure participation of voluntary organization as well as private practitioners who are working in the clinical setup, okay, they should also take part in the delivering of eye care, okay, work in a collaboration manner. Now see what are the strategies of national program for control of blindness. So from the objectives, what we have discussed in the objectives, if you will conclude it, you will get to know about what strategies should be for NPCB, so to provide a best quality of care, okay. So these are the strategies, okay. From the objectives we have concluded, like strengthening service delivery, okay, providing human resource for eye care, promoting outreach activities or providing public awareness, okay. If we will do all of these strategies, if we will follow, of course we will achieve the objectives, okay. Developing institutional capacity means if any institution is working, they should have all of the human resources, they should have all of the facilities, eye care facilities, they should have the screening facilities, diagnostic facilities, that is known as institutional capacity, okay. To establish eye care facilities for every 5 lakh population, this you need to remember, okay. Now, so whatever the strategies we have discussed, it was the old one. We have changed the strategies, means there are some inclusions, okay. We did some inclusion, we have added some points. What are these points under the revised strategies of NPCB? We will see. Strengthening services for other causes of blindness. So before this we were talking only about the main causes of blindness. Now we are talking about the other causes of blindness, like corneal blindness, refractive error in school children. Here we have focused on the school children, okay. Improving follow-up services of cataract operated persons. So I told you in the very initial slides, I told you about the main causes of blindness, and in the main causes there is one of the cause which is related with the cataract surgery, okay. So cataract surgeries, there are sometimes we have seen that these eye surgeries, they are also causing some eye problem, okay. So we need to follow up, improving follow up services of cataract operated persons, so that we can manage the situation, okay. Treating other causes of blindness like glaucoma, okay. To strengthen participation of voluntary organization, and whatever the facilities of eye camp, okay, means which is the mobile eye camp facility. So we need to change it into a fixed facility, okay. Before this revised strategies, what we were doing is we organized some mobile eye camp, okay. Now under this revised strategies, what we want, these mobile eye camp should be fixed eye camp, okay, fixed eye facility care center. So we want a proper infrastructure, okay. Now what are the other points under this revised strategies of NPCB? So to enhance coverage of eye services in the tribal or undeserved areas or unprivileged areas, okay, where the people cannot easily access the facilities or people don't know about this thing, okay. They are not taking their problem up to the mark what they should take, okay. So for those areas we need the coverage, okay. We have to cover our programs on those areas as well. To expand World Bank project activities, okay. So World Bank project activities means they are providing the funds. So for these funds, what we'll do, will construct of dedicated eye OTs and eye wards. Dedicated means which are specialized for eye care, okay. So dedicated eye operation theatres or eye wards, construct them through the World Bank. Apart from it, training of eye surgeons, okay. Then modern cataract surgeries, new techniques which are coming, laser technique which are coming, robotic surgeries are coming. So we have to implement all of the extra or modern techniques which are coming, how to reduce the pain and to manage the situation as better we can do, Okay. Supply of ophthalmic equipments like eye drops or other type of equipments, spectacles or other things we can provide. So, that should be supplied properly. Okay. Now, we will see the organization structure of for the NPCB. Okay. So, this is the organization structure, and if we will see the hierarchy. So, on topmost we have tertiary level. So, tertiary level has all of the facilities, okay. All of the advanced healthcare facilities are available at tertiary care. Okay. Below this there are secondary level. Okay. So, they have facilities, they have the specialized doctors. Okay. So, patients can get the referral to the secondary level. Okay. Then you can see on the lower hierarchy there is a primary level. Okay. So, primary level is, you can say, the first approach for the patients. Okay. So, primary level has the basic facilities. Okay. There are doctors available, but not all of the specialized doctors are there. Okay. So, basic facilities are available at primary care, and if any patient will not get proper diagnostic or screening facilities, of course, from the primary level, the physician will refer the patient to the secondary level. And of course, from the secondary level, if the patient will not get proper treatment, they will or the facilities are not available at secondary level, then they will refer again to the tertiary level. So, this is the level how the patients will be referred from one to the another. Okay. So, if we will see the infrastructure developed or upgraded. Okay. Now, we will see in the primary care, which is a lower hierarchy. So, if I will show you the centers. So, this is the PHC, primary health care. They are more in numbers, they are in the rural areas, they are in the local areas. Okay. This is the basic facilities. Okay. Then after that there is a secondary care, secondary health centers. Okay. Under the secondary health care centers, we have the community hospitals, district level hospitals, this type of hospitals. Okay. And after the secondary health care centers, we have some of the specialized hospitals or advanced sophisticated techniques with all of these fulfilled techniques. So, the hospitals which are providing this is known as THC, tertiary healthcare centers. Okay. And tertiary healthcare centers are also providing research, and they have the research facilities, teaching facilities as well. So, you will see the examples here. In the primary level, which is a basic approach, what are the infrastructure, what are the hospitals here? Sub-district level hospitals, okay, below the district means, or community healthcare centers. Okay. There are some mobile ophthalmic units, okay, which we can move from one area to the another area. So, that is a mobile ophthalmic units. Okay. There is a upgraded PHCs. Okay. So, this is the upgraded version. So, we have upgraded the primary healthcare centers. We have provided some kits for eye care facilities to the PHCs. Okay. Link workers are there who are working in this plan. So, they are linking the patients to the and they are helping helping the patients to reach to the PHC. Okay. So, link workers or panchayats, they are working also in this. After that, you will see the secondary level. Okay. So, secondary levels have district hospitals. Okay. They have upgraded NGOs, eye hospitals. So, upgraded non-governmental organizations, eye hospitals are there. After that, you will see in the tertiary level. In tertiary level, we have medical colleges designated as training centers. So, I told you in the tertiary care centers we have specialized training for the doctors or the nurses or pharmacists or other paramedical staff. So, training centers for PMOAs, eye bank, paramedical ophthalmic assistance, okay, eye banks. So, this is one of the upgradation we did, and upgraded medical colleges are under this. So, medical colleges, I think you are familiar with this. Medical colleges are providing the training to the students. Okay. They have the courses, they are providing courses to the doctors or nurses or pharmacists or some other medical staff, and also they have some research facilities inside the hospital. So, apart from it, there are regional institutes of ophthalmology. These regional institutes of ophthalmology are you can say they are the center of excellence. Okay. So, this is the infrastructure which is working under the National Program for Control of Blindness. Okay. Now, coming to the school eye screening program. Okay. Children are more prone for this visual abnormality. Before this program, I have also discussed about the immunization, okay, in the previous lecture. So, in the immunization, I discussed about the vitamin A. Okay. This vitamin A is provided to the children for avoiding the vision abnormality. Okay. So, children are more prone, and how we can implement our programs at the school level, then only we can prevent the disease. Okay. So, for that we made school eye screening program, SES program. Now, we will see what is the focus area. So, in the school eye screening program, the class from 5th to 8th, okay, this is taken. So, 5th to 8th means 10 to 14 years of age, and they have taken 1,50,000 children, which is to be screened per block. Okay, this is under the scheme. Now, because it is in the school, so there should be a trained teacher. Okay, so one trained teacher to handle the 150 students. Okay, so we will provide some eye care kits to the teacher. Okay, and then they will screen the children. Okay, so 1 day training is given to the teacher to the nearest primary healthcare center. Okay, and they are provided with a teacher kit. So, what is in the teacher kit? There is a vision screening card. So, vision screening cards means there is a one card on which the alphabets are written. So, A, B, C, these alphabets are written and their sizes are different. Okay, and then children have to, what children will do? They will evaluate what is written on these screening these visual screening cards. Okay, and on the basis of the sensitivity of the sizes they can read. So, we will screen, yes, the children's what is the number they will get, means what is the abnormality, the level of abnormality the children has in the vision. Okay. So, vision screening cards or referral cards. Referral cards are for the after the screening, if it is required to refer. So, we can refer it to the PHC or CHC or to the THC. Okay. This is through the referral cards. In this kit there is a tape or a rope to measure 20 feet distance. They are also the part of this screening method. Okay. Now, we will see what is the visual cutoff. So, means on which level we will say yes, there is a abnormality, okay, yes, there is a problem. So, visual cutoff for referral to the nearest PHC. What is the cutoff? It is less than 6/9. If it is less than 6/9, any of the eye will refer the child to another healthcare center. Okay. What are the prerequisites? So, means in any of the schools, if there is a facility of SES, okay, school eye screening. So, what is the basic facilities? There should be a one paramedical ophthalmic assistant, okay, who is helping the teacher. Okay. Relevant equipment should be there. There should be the spectacles, there should be the screening method, there should be the screening cards available, these tape and rope, whatever the part of the screening, they should be available. Okay, or the machineries which are essential for the for checking the eye. Okay, that should be available. Optician contracted for providing spectacles. Okay, so these facilities should be there in the school. Thank you so much, everyone. I hope this is clear to all of you what we have discussed in the National Program for Control of Blindness, what are the causes and how the infrastructure is. Okay. So, we will meet in the next session. Thank you so much, everyone.